So now moving on to more of the physiological functions, especially in terms of gas transport. Oxygen transport is done by the red blood cells. It's when oxygen binds to hemoglobin within those red blood cells. Each hemoglobin molecule has the ability to bind 4 different oxygen atoms. When oxygen is bound to hemoglobin, it's called oxyhemoglobin. So we're going to find that in oxygenated blood. 98.5% of the oxygen is carried this way. So nearly all of our oxygen is being carried by the red blood cells, by the hemoglobin. Some is going to be dissolved in the plasma, and that's about 1.5% of oxygen. That's just going to be dissolved in the plasma of our blood. Carbon dioxide transport is more complex. About 7 to 10% of carbon dioxide is going to be dissolved in the plasma as CO2 molecules. The rest of the carbon dioxide will enter the red blood cells. About 20% of it will bind to hemoglobin, empty hemoglobin, which is called deoxyhemoglobin. And when it binds to the hemoglobin, it's now called carbaminohemoglobin. The rest of it, the other 70%, is going to be converted to bicarbonate while it's in the red blood cells, and then it will enter the plasma as that bicarbonate ion. So this is showing how the carbon dioxide is being transported in the blood. About 7 to 10% is directly dissolved into the plasma. About 20% is going to be carried by the hemoglobin in the red blood cells, and about 70% is converted to bicarbonate in the red blood cells and then put into the plasma. Respiratory drive refers to the intensity of the output of the respiratory centers. This is also known as breathing effort. This is monitored and controlled by the brainstem. And the trigger to increase ventilation is hypercapnia. Hypercapnia is an increase in carbon dioxide levels. Extremely high levels of carbon dioxide results in acidosis. That's a drop in blood pH. It means the blood is becoming more acidic. So normal blood pH is about 7.4. Acidosis is when it becomes less than 7.4. Hypoxic drive only plays a minor role in respiratory drive. Hypoxic drive means that we are low on oxygen. The body uses oxygen chemoreceptors instead of carbon dioxide chemoreceptors to regulate the respiratory cycle in hypoxic drive. Huge drops of oxygen is needed before it becomes a stimulus for increased ventilation. It usually only occurs in individuals with severe respiratory disorders such as emphysema or chronic bronchitis. So most of the time, our body is monitoring carbon dioxide levels to determine our respiratory drive. Only under extreme conditions will it use hypoxic drive or use our oxygen levels. Eupnea is quiet breathing or your resting respiratory rate. This is normal, unlabored breathing, and for an adult, it's about 12 to 20 breaths per minute. It maintains normal blood pH, so this would be normal ventilation. Hypoventilation is slow breathing, and this is often due to hypocapnia. Hypocapnia means low carbon dioxide levels. When carbon dioxide levels are low, it means that the breathing is going to become slower. Extremely low carbon dioxide levels can result in alkalosis, which is an increase in blood pH. Alkalosis means that the blood is becoming more alkaline or more basic, meaning it's going to have a pH greater than 7.4. Apnea is breathing cessation. This is potentially due to extreme hypocapnia, where the carbon dioxide level becomes so low that breathing stops. Sleep apnea is a serious sleep disorder when breathing repeatedly stops and starts during sleep. There's 3 types of sleep apnea. There's obstructive sleep apnea, which is more common, and this is when the throat muscles relax. There's central sleep apnea, and that is when the brain isn't sending proper signals to the breathing muscles. Or there's complex sleep apnea syndrome, and that's when you have both obstructive and central sleep apnea. The symptoms of sleep apnea are loud snoring, gasping for air, awakening with a dry mouth, morning headache, difficulty staying asleep, and excessive daytime sleepiness. It's most commonly treated with a continuous positive airway pressure machine or a CPAP machine. Going back to ventilation rate, hyperventilation is increased depth and rate of breathing. Biologically, this is caused by hypercapnia. Remember, hypercapnia is high carbon dioxide. So you would have hyperventilation as an attempt to reduce high carbon dioxide levels. Aside from the biological cause, it can also be emotionally caused by stress or anxiety. This has nothing to do with high carbon dioxide levels. So in these emotional hyperventilation cases, someone's carbon dioxide levels are normal, but their increased ventilation actually causes hypocapnia. It causes their carbon dioxide level to become low. Their carbon dioxide levels are going to drop below normal. This increases the blood pH, causing it to become more basic. This can cause visual disturbances, dizziness, and blackouts. So the emotional cause, like we were just talking about, starts with normal carbon dioxide. The increased ventilation reduces carbon dioxide, and that's why breathing in a bag helps to return the carbon dioxide levels to normal, because you start rebreathing that carbon dioxide, which is going to stabilize the blood carbon dioxide and the blood pH. With the biological cause, starting with hypercapnia, you're starting with high carbon dioxide levels, and that increased ventilation reduces carbon dioxide levels to normal. In the biological cause, you would not want to breathe into a bag because that's going to cause the carbon dioxide levels to increase and exacerbate the hypercapnia because you'd be rebreathing that carbon dioxide that your body's trying to get rid of in the first place. Other types of ventilation, there's hyperpnea, which is deep breathing. That's going to increase the air volume exchanged, and that often occurs during exercise. Hypopnea is shallow breathing, often due to airway blockage. And dyspnea is shortness of breath. It's when you have difficult or labored breathing.